Hepatitis C is a common viral infection of the liver that is affecting people all around the world. Recently, however, the introduction of new drugs known as DAAs or direct acting antivirals have transformed the treatment and the prognosis of patients with hepatitis C. In this video, we'll examine what to expect when you're undergoing treatment for hepatitis C with DAAs. Hepatitis C is a virus that infects the liver and that is spread by the blood of persons who are infected. 20% of people who are infected with hepatitis C go on to clear the infection spontaneously. The other 80% of people develop what is known as chronic hepatitis C, defined as persistence of the infection for more than 6 months. In the past, doctors were unable to alter the course of the disease. But since 2011, with the introduction of direct acting antivirals or DAAs, persons with hepatitis C can expect to be cured over 90% of the time. They can expect to be cured over 95% of the time if their liver disease is not decompensated at the time they start treatment. The fascinating thing is that they can expect to be cured 95% of the time, regardless of their age or the genotype of the virus that is causing the infection or the viral load of the hepatitis C virus at the time that they start treatment, or even the amount of fibrosis in the liver. The broad spectrum newer DAA agents, such as Maviret and Epclusa, are active against 6 genotypes of the virus, removing much of the difficulty and expense that was involved in initiating treatment with older agents. The icing on the cake is the improvement in duration and tolerability of these treatments. The most frequent side effects that patients experience are headache and fatigue. This means that the overwhelming majority of patients who undergo therapy or treatment for hepatitis C with DAAs, very few of them experience serious side effects, and they're therefore able to complete their treatment. But before treatment is started, certain preparations have to be made. Your providers will run tests, blood tests, to evaluate your liver function and to evaluate your hepatitis C status and your HIV status. And they'll want to know what your kidney function is like. If you're female, they will run a pregnancy test as well. Your liver status will be evaluated by tests that look for fibrosis in the liver and cirrhosis, such as the Fiber 4 index or the FibroScan, a non-invasive test. Alternatively, your provider will want to do a liver biopsy to evaluate the liver for fibrosis and cirrhosis. Your hepatitis B status is important because hepatitis B can reactivate during treatment for hepatitis C with DAAs. Providers will therefore run a hepatitis B surface antigen, a marker that tells whether or not you have active infection with hepatitis B. They will run a hepatitis B core antibody, which is a test that would tell whether or not you had an infection with hepatitis B in the past or are currently infected with hepatitis B. They will also run a hepatitis B surface antibody, a test that can tell whether or not you were vaccinated against the hepatitis B virus or whether you were infected but have cleared the infection. If your hepatitis B surface antigen is positive, they will then do a hepatitis B DNA. And if the DNA is positive and you meet certain criteria, then you should expect to be started on treatment for hepatitis B either before you start therapy with your DAA agents for your hepatitis C or at the time that DAA treatment is initiated. It is also important to note that if the hepatitis B surface antigen is negative, and the core antibody is positive, you can still experience reactivation of hepatitis B during your treatment for hepatitis C with DAAs. This is a rare occurrence, and in cases such as this, providers will monitor your liver function tests on a monthly basis for the duration of your treatment for hepatitis C. Providers will also want to establish a baseline hepatitis C RNA viral load with which they will monitor your progress during your treatment as well as after the completion of treatment. You should expect that your treatment should last anywhere from 8 to 24 weeks. And on the completion of treatment, your provider will repeat the hepatitis C RNA viral load 12 weeks after you've completed treatment to determine whether or not the virus is still detectable in your blood. If the virus is no longer detectable, this means that you've achieved what is known as an SVR, or a sustained virologic response, which is essentially a cure of your hepatitis C. 99 of people who achieve SVR do not relapse. The 5% of people who do not achieve SVR can be retreated at a later point in time. Unfortunately, after being cured of your hepatitis C, it is still possible to be reinfected, and therefore it is important to avoid practices, risky practices that can expose you to reinfection with hepatitis C virus. But what are the benefits of SVR? People who achieve SVR can expect a regression in fibrosis in the liver and even in cirrhosis. They can expect the progression of their disease to stop, and their liver function tests may revert to normal. Eliminating the hepatitis C virus from the blood markedly decreases the risk of developing hepatocellular carcinoma of the liver, a type of hepatic liver cancer that is common in persons with hepatitis C infections, chronic hepatitis C infections. However, this risk is never eliminated completely, and monitoring for hepatocellular carcinoma should continue for an indefinite period of time. This is especially important for persons who have advanced fibrosis and cirrhosis at the time that they initiate treatment with DAAs for hepatitis C. Achieving SVR improves the quality of life, it decreases morbidity and increases survival, and markedly decreases the chances of developing end stage liver disease related conditions such as decompensation and hepatic encephalopathy and esophageal varices and ascites and bleeding. As an added benefit, those symptoms that have nothing to do with the liver and that frequently accompany hepatitis C infections, such as insulin resistance and diabetes mellitus and cryoglobulinemia and rashes and fatigue and tiredness, will often improve, if not disappear completely. So here are the points to take home regarding what to expect when you're undergoing treatment for hepatitis C with DAAs. Number one, expect that your provider will run a series of tests to evaluate your liver functions and to establish a baseline hepatitis C RNA and to evaluate your hepatitis B status and your HIV status. And they will want to run other radiologic tests to evaluate the liver. Expect that your treatment will last from 8 to 24 weeks. Expect that if your hepatitis B surface antigen is positive and then your hepatitis B DNA level is positive, then you will be treated either before the start of DAA therapy for hepatitis C or at the time that DAA therapy is initiated. Expect that if you have acute hepatitis C, You should be treated without waiting for a spontaneous remission. Remember that even after you've achieved SVR, even after you have cured yourself from hepatitis C, that you can still become reinfected, and therefore it is important for you to avoid those practices that can put you at risk for reinfection. And finally, the best part, expect that you'll be cured 95% of the time. 95% of the time, you'll be cured of your hepatitis C. Thanks for watching. I hope you found the video useful. If you did, share the video with friends and family. You can support the channel by subscribing. Until the next video, stay healthy and stay safe.